And now I want to ask you about abortions, the different types of abortions that are performed in India. Fetus or the baby in the womb, when you conduct an abortion, feel any kind of pain? So doctor, tell us, does abortion affect the ability of a woman to get pregnant in future?
Not always. There are some women who will go through an abortion and then conceive naturally and go through and have another normal pregnancy. But a small percentage of women might have infection in the uterine cavity, which affects the uterus from allowing an implantation to happen. There are some women who develop pelvic sepsis, have their fallopian tubes blocked. There are some women who will develop a perforation of the uterus and then subsequently have problems during another pregnancy. So it is not an innocuous procedure that can be ever put down as you can safely go through an abortion and then have children whenever you want. So it has to be thought of as being a fairly complicated and something that requires a thought process to determine whether it is really necessary before going through it.
So by default, you're going to have complications in your next pregnancy?
Not always so.
Not always.
Not always. A small percentage of women might go through a problem in the subsequent pregnancy.
Okay. So there have been these cases where couples have been advised to go through an abortion because through some tests they have detected developmental deficiencies. But post delivery, they turn out to be perfectly healthy babies. So what are these tests that actually detect deficiencies?
You know, over the years, antenatal care came about to be protective towards the mother. Then we looked at the fetus as a patient. So we wanted a healthy mother and a healthy baby. And then it went one step further to be able to diagnose fetal, chromosomal, structural and metabolic defects in utero. The spectrum is very wide, the tolerance is not as wide. Some parents would be intolerant to a small problem such as an extra finger or digit, they'll be intolerant to a cleft lip, while another set of parents would happily accept invitingly a child who even has Down syndrome. Now, as early as about 10 to 13, 14 weeks, an ultrasound examination and a blood test called the dual marker can pick up a lot of aneuploidy, what we call chromosomal abnormalities, as well as structural abnormalities in the baby. Structural abnormalities which are very, very uncomfortable for human life, such as anencephaly or hydrocephalus, too much of fluid in the baby's brain, non-development of the baby's brain, which is incompatible for life, is something that allows a woman to make that decision to terminate the pregnancy. However, many doctors overplay the role of small anomalies, and women as well as families are put against this difficult decision as to whether to go ahead with the pregnancy. Today, a test called the NIPT or non-invasive prenatal testing is a blood test where they pick up cell-free DNA of the embryo or fetus in the mother's blood. And that chromosomal study can tell you very early if there is a chromosomal abnormality in the baby.
And this is as early as?
12 to 14 weeks of the pregnancy, as early as that. Subsequently too, some anomalies which may not show up at the early ultrasound might start showing up at about 16 to 18 to 20 weeks of pregnancy. Congenital heart defects might not be seen early, but they can be picked up as early as 20 to 22 weeks of pregnancy. So more and more, as medical science and technology advances, one is able to pick up these type of abnormalities in the baby. Some parents decide that they are pro-life and they will accept even a failure of the pregnancy if it has to happen naturally. And we so support that decision. And some parents make it very clear that they are intolerant to anything that affects either the chromosomal aspect of the baby's development, a structural anomaly. But to date, we still do not have tests for single gene defects. We still do not have tests for metabolic defects. Autism spectrum also cannot be diagnosed in utero. So when people ask me, are all these tests something that will tell me that the baby is 100% fine, and I give them the example of autism, single gene defects, and I say no test is available with everything being proven to be fine. As things unfold, you come to know during infancy, in early childhood, if people have or children have developmental or other disorders.
Right, it's not always
Not always in utero.
Right. In your 29 years of experience as an OBGYN, what reasons do women come with when they want to have an abortion? Is it always financial, or is it always lack of family support?
The reasons can be very varied. The reasons can be very genuine, and the reasons can be very frivolous. Genuine reasons where an ultrasound shows that the baby has multiple anomalies. The chromosomal tests done show the baby has serious chromosomal problems. You see a problem in the mother's medical condition where you do know that carrying on the pregnancy would probably adversely affect her life. So those I term as very genuine medical problems. And then you have people saying, I do not want to conceive in this month because that is an auspicious month for me when I would deliver the baby. Or I want a gap between my two children as exactly 4.5 years. And this is coming in, say, about 4 years, not to my calculations and my expectations about the due date. And some people would say, I'd rather have a vacation and come back and then conceive. So you have a range of experiences, and it's how you basically would explain to the person. And most people are very, I would call, reasonable thinking.
Right.
And many people who do have frivolous reasons for a termination of pregnancy or want a termination do change their mind and continue the pregnancy. If reasons are put to them that this is a wanted and a live fetus, and they would have to love that child as much as a child who's already born. Why would you have less love in your heart? It's just because the baby is not outside the uterus. You would have to nurture it in the uterus as your own child at that point of time. So when you put a point across where you realize that people have not deciphered that it is human life in the uterus, where you have to be sacrosanct and you have to love, you have to respect. And once you put that point across, you have so many people going ahead and continuing the pregnancy very happily.
That's amazing. That's amazing, really. So there is a common notion, if a woman undergoes more than 2 C-section deliveries, her future pregnancies could be dangerous. Is that true, doctor?
There's a possibility. It could be more dangerous because it is a scarred uterus. If her placenta implants in that lower part of the uterus, she can have a lot of complications, such as what we call a placenta previa, a placenta accreta. So she's likely to bleed a lot during the delivery process. So those are possibilities. But it isn't that every woman who's had 2 cesarean sections will have a definite complication during the pregnancy or the delivery. There's a very strong possibility, and it is a medical indication that she would have to have a cesarean section again, but not always would she run into trouble during that pregnancy or delivery.
So you don't discourage another pregnancy?
Absolutely not.
That's great.